Welcome to the 2025 Safety Presentation, brought to you by California District 54 Little League. My name is Sarah Price Farzanagan, and I am the Assistant District Administrator for Safety. Please note that this presentation is intended for managers and coaches. However, all Little League volunteers are always welcome. Little League is an international organization that supports youth baseball and softball all over the world. Here in the United States, Little League is divided into regions. The Western region is composed of 5 states, including California. Within California, there are 70 districts, and each district is led by a district administrator, or DA, who is elected by the league presidents. The DA's job is to lead and support their member leagues. District 54 is led by Erica Garcia Chuchi and her staff of dedicated volunteers. The 12 member leagues of District 54 are listed here, along with the contact information for the league presidents and the league safety officers. For the most up-to-date information for your league president and safety officer, please make sure to check your league's website. And before we get started, I have no relevant disclosures, but I am a Yankee fan. Since we will be highlighting the key points of Little League safety today, an outline of this presentation, complete with many more details, is posted on the District 54 Safety webpage. From the District 54 homepage, click on the Safety tab at the top and look for the link to the Safety presentation notes. Here are the objectives of this presentation. First of all, let's remember why we are here. Why do you volunteer? 2. Highlight key points of Little League safety. 3. Review required safety training courses. 4. Describe injury reporting and the use of injury data. 5. Review common principles of first aid. 6. Review common injuries and common causes of injuries, which will differ by division. 7. Discuss injury prevention. And finally, review safety with respect to equipment, fields, and child protection policies. Coaches have a unique opportunity to be role models and mentors. You teach the fundamental skills of the game, along with skills like sportsmanship, teamwork, and collaboration. You lead with integrity and by example. Your players and their families will emulate you. And you inspire athletes to be respectful and responsible members of the team. You can also inspire the adults around you to prioritize player safety and to celebrate and respect the spirit of the game. ASAP is shorthand for a Safety Awareness Program, Little League's comprehensive program focused on participant safety. The ASAP requires that every league have its own safety plan. There are 15 main requirements. However, most of our leagues have expanded their safety plans to meet the needs of their league. All coaches must receive a copy of their league safety plan, and they should read it and be familiar with it. One requirement of the ASAP is safety training. Little League requires managers and coaches to complete mandated reporter training, such as the Abuse Awareness course offered by USA Baseball or Safe Sport, on an annual basis. Little League also requires an annual background check through JD Palatine. The state of California's background check is a live scan background check that is done once and is good for the entire duration of your relationship with your league. The state of California also requires an annual concussion education course and an annual sudden cardiac arrest prevention course. Little League Diamond Leader training is required for all tournament managers and coaches, but all coaches are highly encouraged to become a Diamond Leader. This is a free one-time training course that discusses mental, social, and emotional benefits of youth sports, along with ideas and tools for managers and coaches to provide their players with a positive Little League experience. Now let's talk about injury reporting. The first component of injury reporting is the medical release form. Little League requires every player to submit a medical release form every year. It's a good idea for managers to review these forms at the beginning of the season so that they can be aware of any medical issues on their team. Please feel free to ask parents to discuss any medical concerns with you before the season starts, and be sure to keep these conversations private. Managers are required to keep these medical release forms with them at every Little League event, and please be aware that they contain personal information and should be kept confidential. The second component of injury reporting is what needs to be reported. It seems obvious that severe injuries and injuries that require medical attention should be reported, and they should. But also look for incidents that could trigger things like corrective action, educational interventions, or serve as a warning. For example, a player that trips over a bat left on the field. Or there are players in one particular division that are colliding with each other multiple times per game on defense. Even if no one is hurt, these situations could result in serious injury. Corrective measures can be taken to address field assignments, practicing appropriate techniques, and also review of the placement of equipment. In a situation where a player or a coach steps in a hole on the field, an incident report will trigger immediate corrective action even if there was no injury, and also a review of other fields for safety. We can't eliminate all injuries or accidents, but we can use them to identify the cause so something can be done to prevent occurrence, or at the very least prevent them from happening again. The third component of injury reporting is when to report. All injury reports should be made to the league safety officer within 24 hours. The safety officer is then responsible for contacting the person involved or the parent of the player involved, first of all to check on them, second of all to confirm any information that's required for the injury tracking form. Safety officers keep records of injury reports and also report them to the district safety officer. The fourth component of injury reporting is how to report. The person responsible for reporting injuries is the team manager. There are two ways to submit injury reports. One is using a QR code attached to a Google form, and the other is using the injury tracking form. The injury tracking form is on paper. The manager would fill this out. The top section contains demographic information that's found on the player's medical release form, or it can be obtained from the person involved if it's not a player. The rest is information about the injury or the incident, and then this form is sent to the safety officer. Most of our leagues in the district use a QR code method for reporting injuries. So you would scan the QR code with a mobile device, and it takes you to an injury reporting Google form, which when completed is sent to the safety officer. Please check your league safety plan for your particular league's injury reporting procedure and contact your safety officer if you have any questions. If medical attention is required for an injury, then your league safety officer should encourage the parent or guardian of the player involved or the person who was involved to fill out the Little League accident notification form. The person involved or the parent would fill out this form and send it to the safety officer, who completes their portion on the second page, signs it, and then sends it to Little League within 20 days of the incident. This process, most importantly, activates the secondary insurance policy provided by Little League. It also serves as an injury notification for Little League. But primarily, we use this form to activate that secondary insurance in case the player or person involved may need extra coverage for any medical attention they've required for that injury. The final component of the injury reporting process is return to play after an injury. Any player who has been removed from play for a suspected concussion, who needed professional services for an injury, or has been out of play for 7 or more days due to an injury, must provide the safety officer with a written clearance note from an accredited medical provider. What is it that we do with all of this injury reporting information? At the league level, safety officers keep injury reporting records, and they present this information to their boards at monthly meetings for discussion and for any action that may need to be taken as a result. At the district level, all injury reports that are received by the district safety officer are first de-identified. All personal and identifying information is removed and destroyed according to the Health Insurance Portability and Accountability Act, or HIPAA. The de-identified information is then analyzed and presented to the league presidents at monthly district presidents' meetings. The injury reporting information that we collect allows the district to identify improvements in safety practices and procedures, and also to enhance injury prevention strategies throughout all of our local leagues. The next topic we will discuss is first aid, including CPR and AEDs. This is not a first aid course. The Red Cross has a great selection of courses that are available both online or in person that you can choose from at their website, redcross.org. The first aid do and do nots are overarching principles to keep in mind during your journey with Little League. Do ask permission before providing first aid, even to a child. Do know your limitations, and do always have a mobile phone with you. Do not panic. Do not administer medications. Do not leave a child unattended after a practice or game. As we will talk about more in the Child Protection Policies section, an adult volunteer should never be alone with a child. 2 mandated reporters should be present with that child. Finally, do not be afraid to ask for help. All league safety plans will have an emergency action plan or procedure. Please check your safety plan for those instructions and for any local emergency numbers that you should have on hand. You can also check with your team families before the season begins to see if anyone is a medical professional or a first responder or otherwise trained that could help you in an emergency situation. As we all learned in our sudden cardiac arrest prevention training, a lot of people, about 350,000, die from cardiac arrest per year in the United States outside of the hospital. When someone has a sudden cardiac arrest in the community and survives, it is because a bystander performed CPR, cardiopulmonary resuscitation. Immediate CPR can double or triple the chance of survival after a cardiac arrest. The first 3 steps in the cardiac chain of survival shown here, which is before emergency services arrive, are 1. Recognition and calling 911, 2. Performing early CPR, and 3. Rapid defibrillation if an AED is on site. And so whether or not an AED is on the way, CPR is key to increasing the chance of survival in the case of a sudden cardiac arrest in a child or in an adult. Welcome back. Let's carry on. Most injuries that occur during Little League play are minor, and they're also often preventable. Serious injuries are less common, but you need to know what to do if one occurs. Coaches should be aware of the most common injuries in their division because injury risk varies so widely by age. Heat issues affect all players, but the youngest are the most susceptible. In the youngest divisions, things like collisions, being accidentally hit by a ball or a swinging bat, or climbing the fences are common reasons for injury. In single A and double A, contusions, abrasions, and collisions are more common, and elbow and shoulder issues as well as being hit by a pitch become more common as pitching is introduced. In AAA and majors, contusions, abrasions continue as well as some growth plate issues and occasional fractures. In the upper divisions, As adolescents and their bodies are maturing, they have less growth plate issues and more ligament problems, with continued contusions and abrasions associated with collisions and sliding. As I just mentioned, contusions or bruises are common at all levels in Little League, though they have different causes depending on the level of play. When soft tissue is hit by a baseball, etc., bleeding under the skin causes the discoloration we associate with a bruise. When a bone is hit, a similar process occurs, producing a bone bruise. One example would be a player who falls directly onto the kneecap, or a player that's hit by a ball in their shin. Contusion should be treated with ice and compression, and if there is no concurrent injury to a joint, the player may return to play when they are feeling able. And one note when you're applying ice, do not apply ice directly to the skin, and do not leave it on for more than 15 to 20 minutes at a time. Skin abrasions are common at all levels, and especially when players start sliding or are playing on turf. All first aid kits should contain wound cleaning supplies and adhesive bandages. When treating abrasions, use universal precautions, which means you should be wearing gloves. Clean abrasions with water and cover them. If the abrasion is acute and moist, like the one on the left, it should be covered with or without antibiotic cream. If the abrasion is dry, like the one on the right, it does not need to be covered unless it runs the risk of bleeding, and therefore should be covered for protection. In the case of a bloody nose, again, use universal precautions, wearing gloves. Have the player pinch their nostrils, lean slightly forward, and hold there for 5 minutes. Check for any continued bleeding after 5 minutes. If the bleeding has not stopped within 15 minutes, then the player needs to be taken to the emergency department. Little League's policy on communicable diseases says that for any bleeding or open wound, the player must leave the field until the bleeding is stopped, the wound is covered, and the uniform is changed and/or the body is cleaned. The player absolutely cannot go back out on the field with blood on their uniform. In many ways, children are not small adults, but this is especially true when we're talking about heat illness. Children produce more heat with activity, and their bodies are not as adept at cooling as adults, which means that kids can overheat very, very quickly. When we're talking about heat illness, it's often a spectrum of symptoms, and usually the first symptom of heat illness are heat cramps, which are muscle spasms or muscle pain. If you move the player to a cool spot in the shade and hydrate, you can massage the muscles gently. Sometimes that helps. Often this will go away. If the heat illness progresses and gets worse, they can have heat exhaustion, which looks like fatigue, weakness, nausea, or even vomiting. Again, move the player to a cool spot, have them rest, and hydrate. Heat stroke is a medical emergency and is life-threatening. Those symptoms are having hot, dry skin, confusion, vomiting, and maybe even blacking out. On any given day, leagues make decisions about whether or not to cancel events. But when it's hot on the field, coaches and umpires can absolutely modify play to allow for shade and water breaks as much as needed. We only want to play when it's safe. Moving on to musculoskeletal injuries, again, we need to remember that children are not small adults. Their bones are still growing pretty fast, which means the growth plates in their bones are still open. Growth plates are located at either end of every bone in the body, and they are the most vulnerable component of the musculoskeletal system to injury. And when you add that to the fact that throwing a baseball or a softball is an unnatural movement and generates excessively high forces at both the elbow and the shoulder, there is a recipe for injury here that we need to be aware of. So the key points to remember as we go over the next few injuries are that In children, bones are growing very quickly and soft tissues are stretching tightly because they're not growing as fast and can't keep up. So that results in both weakness and stiffness of the muscles and soft tissues. It also pulls on the growth plates, which are already the weak link in the system. So to prevent injury to these vulnerable tissues, pain in a child must not be ignored. And unfortunately, a lot of kids do have pain while participating in Little League. In fact, more than 70% of baseball players, ages 8 to 18, report arm pain with throwing. And 5% of youth pitchers will have a serious elbow or shoulder injury within 5 years. So if they started pitching around age 9, then by age 13 or 14, 5 out of the 100 or so kids in a AAA division will have a serious injury. The main risk factors for these injuries are pitching while fatigued, poor pitching mechanics, high pitching velocity, throwing too hard, and high pitch counts on the level of 120 to 130 or 40 per game. All of these risk factors contribute to high rotational forces on the upper humerus, the arm bone, while throwing. And a result of that could be an overuse injury to the growth plate at the top of the humerus near the shoulder, and we call this Little League shoulder. Players will often complain of pain in the upper part of the arm. That's worse with throwing. And if the growth plate has been injured, you'll see findings on an x-ray looking like this, widening of that irregular black line at the top of the humerus where that blue arrow is pointing. That's an injury to the growth plate. Treatment for this is rest from throwing until the pain and tenderness goes away, and then the player can start a return to throwing program, which could take several months. This particular growth plate starts to close around age 14 and is usually completely fused into solid bone around age 17. And at that point, shoulder pain with throwing is going to be more likely due to a rotator cuff tendon problem. This can be a painful injury, and it's frustrating to deal with the return to play rehabilitation. So we really want to make sure to teach our athletes good throwing mechanics and keeping track of those pitch counts, resting when they're tired, resting when they're having pain, so we can avoid athletes having to deal with this type of injury. Throwing also puts relatively high forces through the elbow joint. These forces are more linear and either stretch or compress the joint. So it's a stretching or a tensile force across the inside of the elbow, the medial side or the pinky side, and a compression force on the outside of the elbow, the lateral elbow. And in our Little League players, they have growth plates that are still open in these areas that are particularly susceptible to injury from these throwing forces. So in the elbow, overuse can cause progressive stress on the growth plate on the inside of the elbow, the medial side, the pinky side, which can injure that growth plate. There's a ligament that attaches right over that growth plate that's much stronger, and it pulls on that growth plate over time as the player continues to throw, and it can injure the growth plate, as you can see in the x-ray on the left compared to the x-ray on the right. This is painful, and the player will feel pain on that inside part of the elbow at first with throwing, and then as the injury progresses, the pain can also be present at rest, and there may also be tenderness over that area. The treatment for this injury, again, is rest until the pain and tenderness resolves, which means the growth plate is healed. And then once it's healed, again, the next step is a gradual return to throwing program over several months. On the outside of the elbow, the lateral side or the thumb side, overuse causes repetitive compression on the elbow joint. And this is most common in adolescents, ages 10 to 18, and they will complain of lateral elbow pain with throwing that gets worse over time. And that repetitive compression is causing compression of the cartilage, and could also result in some bone injury. And you can see bone injury right under those 3 yellow arrows in the radiograph on the right. Treatment varies for this condition and depends on the extent of the injury, but again, we really don't want to find ourselves here with our Little League players. Good communication between players and their parents and their coaches plays a big role in preventing these types of overuse injuries. Fractures or broken bones are less common, and we definitely try to avoid these and prevent them where we can. But when they do occur, they can be very significant, and sometimes they cannot be avoided. A common cause of fractures in baseball and softball are body parts being hit by the ball, fingers, hands, but also feet and toes. There's also chronic fractures. So this little bone on the pinky side of the wrist, the hook of the hamate bone, can become fractured due to chronic repetitive trauma from swinging a bat. If you do suspect a fracture, if it's obvious there's a deformity, or if it's an open fracture, if you see bone protruding through the skin, please call 911. If the player has swelling, pain with bearing weight, or they have painful or limited movement of a joint or an area of their body, they definitely need medical evaluation. Use your common sense, and it often is very helpful to get parental input when deciding what to do with possible fracture. We can prevent a lot of these musculoskeletal injuries if we keep in mind that children are growing very quickly. Their bones are growing faster than their soft tissues, which makes them tight and weak and stiff, and it also pulls on the growth plates, which are the weak link in their system. Please don't dismiss a complaint of pain in a child. Investigate and talk to their parents. A few uncommon injuries are important to mention at this point, and even though they are not as common as some of the things we've already talked about, they do happen, and they tend to be more serious. Let's start with asthma and allergies. Asthma is a fairly common condition in young people, and asthma exacerbations can be triggered by extreme weather, hot or cold, allergens like pollen, or viral illnesses. You should know who on your team carries a rescue inhaler and if they know how to use it. Otherwise, arrangements need to be made so that a parent is available to help the player use it if they need it. Allergic reactions, severe ones, can happen with any number of things, but bee stings and nuts will be the most common reason. Again, you need to know who on your team has this type of allergy, and if it's severe enough of a reaction and they're carrying an EpiPen with them, you need to know if they know how to use it or if a parent will be available to give it to them. You should know if an EpiPen is administered, you must call 911. And if the player is having an allergic reaction, a severe life-threatening allergic reaction, the EpiPen should be given early. The longer you wait to administer it, the harder it is to stop an allergic reaction. And again, you will have all of the players' medical release forms with you, and all of their medical information is on there. So make sure you have those with you at every practice and every game. In the case of a dental injury, the first step, using universal precautions, is to control the bleeding. And having the person bite on a clean towel works very well to do that. Then find the tooth or the piece of the tooth if it came out. Rinse it in clean water. Then you can either reinsert the tooth or store it for transport in either milk, not water, or between the cheek and the gum in the player's mouth. That second strategy I would recommend employing only if you can count on the child not to swallow the tooth or piece of the tooth. Prevention strategies include using mouth guards, especially for the kiddos who have orthodontic appliances, chin guards on helmets, and face masks, like for the catchers, umpires, and even pitchers. We've all learned about concussions in our annual education course, so this will be a very quick summary. A concussion is a brain injury that can result either from a direct blow to the head or a blow to the body, which transmits the force to the head. For example, in a collision, two players collide. It's a functional injury, which means that the player will have trouble thinking, concentrating, and paying attention. They often have a headache, maybe nausea, or trouble with their balance. If an athlete is suspected of having a concussion injury, per California state law, they cannot return to play that day. They must be treated and can only be cleared by a qualified healthcare professional, and that clearance needs to be in writing. Please make sure you refer all suspected concussion injuries to your safety officer through your injury reporting mechanism. This is a great handout for coaches to have on hand. Print out a couple at the beginning of the season and throw it in your bag or in your folder. It has your concussion action plan on there. It also has a list of concussion signs and symptoms, and you can give this right to a player and their families in the case that they've sustained a concussion or a suspected concussion. This handout is a reference for sudden cardiac arrest. You can print one of these out and keep it in your bag and hope you'll never have to take it out again. There is a symptom action plan as well as a cardiac arrest action plan to have on hand as a reminder. Injury prevention is a priority of all of our safety plans. And the best way to prevent injuries is to look at the most common causes of injuries, and that can help inform our prevention strategies. Some of the common themes related to player injuries are lapses in attention, poor communication, messing around on the field, in the dugout, hazards on the field, and prior medical problems. We can use our district injury reporting data to get even more specific regarding causes of injuries. Being hit by the ball is the most predominant mechanism of injury, and that could be being hit by a pitch, in which case you can train your players to avoid wild pitches and how to turn their body away from the ball while they're in the batter's box. The ball tipping off the glove when they're trying to field it and then hitting them in the face. Going over proper fielding technique with your players can help alleviate some of that. Sometimes, though, it takes a bad bounce or it's just bad luck or the player's not paying attention. But even those situations, we can do some injury prevention in terms of field maintenance, inspecting the fields before practices and games, keeping a good, tight management on your practices and making sure players know what they're supposed to be doing and they're paying attention. The next most common mechanism of injury is sliding. And some of these injuries were due to poor technique. And in fact, this resulted in a pattern that we noticed, which then we were able to put out a communication to coaches with resources on teaching appropriate sliding techniques. In a lot of cases, sliding results in injuries to the hands, wrists, and fingers. It gets caught on another player or on the base. Sometimes the head, more commonly when home plate is involved, and injuries to the lower limb. Injuries from bats are more of an issue in the lower divisions and are usually accidental and usually occur in the dugout. Some younger division teams will rotate a dugout parent as a duty to help manage the younger players in the dugout so managers and coaches can focus on what's going on the field and on their coaching responsibilities. This parent can address behavior and dugout injury issues like bats and also climbing on fences. Keep in mind, if you are going to use a dugout parent, this parent must be an official Little League volunteer with a JDP background check, and new this year, the mandated reporter training. Injuries in adult Little League volunteers are infrequent, but they still can happen. In coaches, they can get hit by the ball or be injured because of some field hazard. The adult volunteers could be related to handling equipment, say doing field prep or managing something in the equipment shed, or something related to the environment off the field, like bleachers. And in umpires, most often it's a heat-related issue in terms of the causes of injury in that population. So coaches, make sure you're inspecting the field, make sure you're paying attention, your players are paying attention when balls are flying. For your volunteers in your league, make sure you're demonstrating proper use of the equipment and helping them if they need assistance, and making sure everybody who's on the field, players, coaches, and umpires, are staying adequately hydrated. In summary, here are some general principles of injury prevention. First, play safe. Know the rules and educate your players so that they know the rules. Create a culture of teamwork and safe play, and encourage your players to take care of each other. Enforce bat safety at all times across all divisions, but especially in the younger divisions, and enlist the help of a parent if needed. Teach the fundamentals of the game and also good communication skills. Reinforce proper technique throughout the season, not just in the beginning. Sports gear should fit properly and be Little League approved. Things like helmets, catcher's gear with a dangling throat guard, sport cups for young men, sports bras for young ladies. Take breaks for water and for shade in hot weather for sure, but also take breaks for fun. Encourage your players to communicate with you, and please don't let them play through pain. Regular conditioning is great to strengthen muscles. The age of our Little League population, though, what's recommended is not more than body weight, so no added weights. Stretching after games and practice regularly when the body is warm can greatly increase overall flexibility, so those cool down stretches are really, really important. Dynamic warm-up is recommended prior to activity. Dynamic meaning gentle, repetitive movements that gradually increase the range of motion that prepares the body for that activity. Evidence strongly suggests that pre-exercise static stretching does not reduce the risk of muscle injury. Muscle injuries occur when the muscle is not strong enough or it did not contract at the right time. A typical dynamic warm-up begins with a general warm-up to increase blood flow to the heart and to the muscles and to prepare the body to get going. Then, the warm-up should gradually increase the range of motion of the body, but stay within normal range of motion. The goal of the warm-up is to optimize, not to maximize, the range of motion. This is one example of a dynamic warm-up for baseball and softball from the University of Rochester Sports Medicine Center. The University of Pittsburgh also has a very basic dynamic warm-up that you can use, but the main idea of both or any of these dynamic warm-up programs is to warm up to throw, not throw to warm up. Pitch count is the most important number that coaches need to track because it is the absolute key to preventing shoulder and elbow injuries. So please know the limit for your players and stick to it. Your league is tracking pitch counts, and it's best practice for coaches to do so as well. And keep in mind that pitch counts keep running. In a doubleheader situation, it doesn't reset for the second game. A second thing to keep in mind is that a player's total pitch count encompasses pitches thrown in Little League, in addition to pitches thrown in baseball or softball activities outside of Little League. Keeping track of this requires really effective and open communication between coaches and parents, so it's a good idea to work to foster that relationship in the best interest of your players. Every pitch count threshold has an associated required number of rest days. So please know for your league age what the maximum pitch count is and what your number of rest days will be for your players based on their pitch count. we are in the home stretch. Moving on to equipment and field safety. In addition to any necessary team equipment, managers and coaches should always have their player medical release forms, a first aid kit, and a copy of their league safety manual, the safety plan. In a lot of cases, that will be distributed electronically to coaches, but most fields, the equipment sheds, and concession stands should have a printed copy available. Managers and coaches are responsible for inspecting all team equipment, both upon receipt from your league and also before each practice and game. They are also responsible for inspecting fields before every practice and game. Helmets must meet NOCSAE standards, and bats must meet USA bat standards, even at practices. Catcher's gear must include a helmet, mask and dangling throat protector, chest protector, and shin and knee guards. Umpires are also responsible for inspecting equipment before games and also inspecting fields before games. Weather and animal safety. Most often we are going to have weather issues related to heat, so always be aware again that children's bodies cannot tolerate the heat as well as adults can, and so in hot weather, provide shaded areas for breaks, encourage all the players, the coaches, and the umpires, and the spectators to hydrate, take water breaks and sit in the shade as needed, and also encourage your players to wear sunscreen. Air quality is usually not an issue until the summertime, so hopefully that won't be an issue this year, but the district air quality policy does say that all activities should be suspended if the air quality index is 150 or above. Most counties in our district use Purple Air as the air quality index reference, so you can look on purpleair.com for that number. The other weather issue we may encounter is a thunderstorm. Little League Rulebook Appendix A lists the lightning safety guidelines, but in general, if you hear thunder, that usually means the storm is within about 10 miles, and 30 seconds or less between lightning and then thunder means the storm is less than 6 miles away. So if you hear thunder, if you see lightning, get everyone to safety, wait at least 30 minutes after the storm passes before resuming activities. If someone is struck by lightning, medical attention is needed, so call 911. Making sure the scene is safe, provide CPR if you can. Our district spans a pretty wide area and several counties, so we have several varieties of critters that may be infringing on our field space. If there is any wildlife on the field, don't approach it, don't attempt to remove it yourself, call for help, and keep everyone away from the field until the animal has been removed. Here is a summary of Little League's child protection policies. Little League requires all adult volunteers to have an annual background check and to complete an annual abuse awareness training course. The state of California further requires live scan fingerprinting background checks for adult volunteers who spend more than 16 hours per month or 32 hours per year around children. This includes your board members, coaches, umpires, and any other volunteers that spend about 2 hours per week on the field or around children. The state of California defines adult volunteers in youth sports organizations as mandated reporters, which means that you are required to report within 24 hours any reports of child abuse or suspected child abuse to your local sheriff's office. As a mandated reporter, please remember that there must be at least 2 mandated reporters whenever there are children present. According to Little League's Child Protection Program, no personal information for children may be placed on a website. And Little League has rules about written permission for posting photos of children and of adults. You can find a release form template on the Little League website. Your league should have a designated person who's in charge of your league's website and social media, and so if you have any questions, you can contact that person or your league president with any questions. Finally, we all want to provide a positive experience for all of our Little League participants. The key to that is communication. So have open and honest communication with your parents and your players' families from that first preseason meeting. Ask the families, how can I help your child learn and have fun? Is there anything that you want me to be aware of? Medical problems, learning or behavior issues, any impairments or disabilities? Always keep in mind that all children learn differently, but you can use their families as a resource to help you provide the best possible experience for their child. To conclude this presentation, I encourage all of you to remember why it is that you volunteer with Little League. I hope you have a wonderful season this year. Thank you very much for watching this video. I hope that it was helpful. And if you have any questions, please reach out to me or to Mac or visit our website. Thank you for your time today. To claim your certificate of completion for this safety presentation, you can scan the QR code or click on the link to the Google form, fill it out, and your certificate will be emailed directly to you. You can complete the form even if you do not have a Google account. Your certificate should then be sent to the appropriate person in your league. Please don't send it to me at the district. Please send it to your league. If you're not sure who to send it to, please contact your safety officer or your league president. Once again, thank you so much for volunteering with Little League. We sincerely appreciate your time and your enthusiasm. And again, we wish you a wonderful season. See you out there.